first and last name for editing purposes?
Yeah, first name is Steve, Steve. Last name is Crossman, Crossman.
Excellent. Thank you for that. For you to receive your dental care.
The reason this place gives wonderful dental care is, in my opinion, Dr. Rick Miller. He's very caring. He's trustworthy. I have all the confidence in the world and in him and in the folks who work for him.
Excellent. Care.
When I'm receiving care, Dr. Miller will explain what is what the issue is or what he's concerned about, and so I understand completely going in the decision I'm making. Yeah, let's do that, or okay, we'll wait, whatever. Yeah, so I guess just he's very patient.
That helps a lot, doesn't it?
No, it does.
Health.
What has Dr. Miller done to improve my overall oral health? Well, number one, it would have to be the regular cleanings. I'm not one of those who fears the dentist, so preventive maintenance certainly is key. And then, of course, when there's something major that needs to be done, for example, I had to have a root canal. I knew it before I even came in, and but he's very methodical and does a wonderful job, and yeah, I don't know what to tell you. I mean, teeth is teeth, but he knows teeth, so yeah.
That's good. Your experience with the root canal, was it comfortable, and were you surprised at how the procedure went?
Root canal? Well, I'd never had a root canal before. I'd heard horror stories. I'd heard other people say, "Oh, it's not so bad." I think it's the not knowing, which is disconcerting. I mean, when you've not been there before, it's worrisome. I mean, I can remember when I had to have the root canal done. I came in right before Thanksgiving, and I believe I had to come back 3 or 4 times. And I was thinking, should I have just had that tooth pulled to begin with? And realized afterwards, no, it's just a process. It just takes time. Yeah, he did a great job. I haven't had any issues at all with that tooth since that time. Well, nor any other teeth. So yeah.
Sounds like the preventative stuff's working out. That's great.
Yeah, hope so. I'm getting old.
What was happening that caused the root canal?
It was a tooth that I had a crown put on some years before, and wow, I mean, why that happened? Well, in my opinion, it has to do with the. I'm a grinder. I'll grind my teeth at night, so probably from when I wore a retainer and would bite down on that retainer, or I just wore that tooth out.
Or lack of confidence smiling. If so, how has Dr. Miller worked to help you overcome those struggles?
I've never actually had struggles. I mean, smiling or anything else. I mean, my parents made us as kids go to the dentist on a regular basis, and that's why I don't fear going to the dentist. I mean, I actually enjoy the cleanings. That's as long as you're on the west side, which is the cleaning side, you're in good shape. If you have to go to the east side, which would be, I'd say, the root canal side, you know, not as pleasant, but at least he's gonna, you're gonna get wonderful service. He's gonna do a wonderful job. So, yeah. No, I have not been treated for teeth grinding. He's recommended I get a guard, and I haven't done that. But yeah.
Okay. Just thought I'd ask. Friends or family members or
Mm-hmm.
coworkers even that are in the market for a dentist, what would you tell them about this place? How would you pitch coming to see Dr. Miller to them?
How would I pitch Dr. Miller's practice? It had to be his concern for each individual patient. And of course, in any business relationship, it's all about trust. So if you have that trust in the individual with whom you're working, you then have the confidence that they're going to do a good job for you. And I'm there. I mean, I absolutely trust Dr. Miller. In fact, I'll give you a little background too, just why I first came to this practice. It was 6 years ago. I was working for a company that had been acquired by a big Swiss bank. It was spring of 2009. Bad recession. They decided they were going to lay off 60,000 people. I was one of them. I'd been with this company 17 years, but I was terminated. And Dr. Miller and I attended a Bible study together. And I had mentioned it to a couple of guys. And Dr. Miller, out of hundreds of guys in this room, came up to me afterwards, handed me his business card, and said, I would love to be able to help you if I can. And that really meant a lot to me. I knew instantly that he was a man of character, integrity, and I had been considering changing dentists. I'd been with my previous dentist for a long time. The dentist I had been going to, he sold his practice to a younger guy, and I was ready to make a change, and it was the right thing to change and come to Dr. Miller. I have a lot more confidence in him. But that's, in a nutshell, it was his caring, his concern, and I knew that right from the very beginning. I had not met him before, but that meant a tremendous amount to me.
Goes a long way. Yet that you were wanting to talk about as far as your care, Dr. Miller, or the staff, that kind of thing.
Is there anything I want to talk about that you haven't mentioned? The only thing I'd say is I usually have 7 a.m. appointments because I'm driving out of my way to come to this office. I live further south and east, so I'm having to come north to come to the dentist. So I come first thing in the morning, 7 a.m., and then I drive south to go to my office. So the only thing I would say is oftentimes I'm 3 or 4 minutes late after 7 a.m., and they're very patient. I mean, I'm here, but I'm a few minutes late, and I'm always conscientious that now, because I mean, time is money. So yeah, they're very good to work with. Yeah.
That's great. Yeah, that's it says something that you're